Good afternoon, everyone. The topic for today's class is health agencies around the world or the international health agencies. The contents are introduction, classification of international health agencies, which include WHO, UNESCO, UNSAIDs, Red Cross, CARE, etc. Coming to introduction. The International Health Organization are a major source of expert technical advice and training for local health professionals. These organizations produce the key textbooks in tropical health as well as the most important manual for healthcare workers. A large number of organizations of various sizes produce international health aid. The exact role played by this organization can be confusing even to professionals. What follows is a description of the function of the largest international health organization. After a look at major organizations providing long-term health care, the focus shifts to those that specialize in giving aids to the victims of war, families, and natural disasters. Classification of the international health agencies. We have multilateral organization like WHO, Pan American Health Organization, World Bank, UNICEF, UNFPA, and United Nations Development Program. In bilateral, we have United Nations Agency for International Development, and non-government organization is International Red Cross and Red Crescent Movement, individual national Red Cross societies, food and care. Multilateral organization. The term multilateral means that funding comes from multiple governments and is distributed to many countries. The major multilateral organizations are all part of United Nations. Bilateral agencies are the government agencies in single country which provide aid to the developing countries. Non-government organizations or NGOs, also known as private voluntary organizations, provide 20% of all external health aid to developing countries. Most of these organizations are quite small, many to church affiliated. In very poorest countries, hospitals and clinics run by missionary societies are important. The largest NGO devoted to international health is the United Nations is Project Hope. Coming to the first international organization, that is WHO, World Health Organization. For the formulation, it has its origin in April 1947 during a conference held in San Francisco. The former existence was made on April 7, 1948. So 7th April is celebrated as World Health Day. On this day, various themes are set up by WHO to focus attention towards specific aspects of public health. The theme for the year 2020 was to support nurses and midwives. WHO chose 2020 as the year of nurses and midwives because of contribution which the nurses and midwives have made during the healthier place. Silent points are that a specialized non-political agency of United Nations established in 1946 has headquarters in Geneva, constitution drafted by Technical Reparative Committee and came into force on 7th April 1948. Structure, it has the World Health Assembly, supreme governing body, annual meetings is held and composed of the delegates of different countries. It has an executive board and the secretariat. Work is prevention and control of specific disease, development of comprehensive services, family health, biomedical research, health statistics, environmental health, health literature information, and cooperation with other organizations. Coming to UNICEF, it is a specialized agency of United Nations established in 1946 to rehabilitate children in war-raged countries. 1953, when emergency function was over, General Assembly gave its new name UN Children Fund but retained the initials. So it's giving greater attention to the concept of the whole child. It has the headquarters located in New York. Funding is derived voluntary from the government and also from the non-government organizations. Function is that it believes that child have the right to adequate nutrition, education, health, participation, protection, and clean water. Functions, it works in collaboration with FAO, UNDP, WHO, and UNESCO. In early years, UNICEF and WHO have worked together on problems like malaria, tuberculosis, and venereal disease. It provides assistance in fields of maternal and child health and environmental sanitation. Child nutrition, it gives high priority to the child nutrition. Second is family and child welfare, which it provides the services to the parent education, daycare centers, and the women's club. Third is education. It runs various child health revolution known as GOBI, that is growth chart, oral rehydration, breastfeeding, and immunization programs. Next is UNESCO. Full form is United Nations Educational, Scientific and Cultural Organization. It is a specialized agency of the United Nations. It is a higher of League of National International Committee on Intellectual Cooperation. It has 195 member states and 9 associate members. It pursues objectives through 5 problems, that is education, natural science, social and human sciences, culture, communication and information. Function is to contribute to peace and security by promoting international collaboration through education, science and culture. Next is International Red Cross Society. The Red Cross is non-political, non-official international organization. First Geneva Convention took place in 1964 and treaty was signed for relief of wounded and sick of the armies. Thus came into being the International Committee of Red Cross, an independent institute founded by the Red Cross. Function is that it is confined to the victims of war, mainly tries to involve itself into activities like first aid in case of war situation, and it also extends its research in disaster management. Next is CARE. CARE stands for Cooperation for Assistance and Relief Everywhere. It was founded in North America in the wake of Second World War in the year 1945. It is one of the world's largest independent, non-profit, non-sectarian international relief and development organization. Function is to provide emergency aid and long-term development. It began its operation in India in 1950 to 1980s to provide food for the children in the age group of 6 to 11 years. Collaboration, it works in partnership with following associations: Government of India, state government, NGOs. It has its projects in Andhra Pradesh, Bihar, Madhya Pradesh, Maharashtra, Odisha, Rajasthan, Uttar Pradesh, and West Bengal. Next is USAID. It stands for United Nations Agency for International Development. The US government presently extends aid to India through its agencies, that is USAID, the Public Law 480 program, and the US Export Import Bank. USAID was created in 1961. It is in charge of activities previously administered by Technical Cooperation Mission TCM. Its mission functions in New Delhi. It gives both grants and loans which are extended by the agency. Functions. The US has been assisting in a number of projects designed to improve the health of the Indian population. The recent trend in assistance from US is increasing the support of the agriculture and family planning programs with some reduction in aid to the general public health field. The best way to prevent and slow down transmission is to be well informed about the COVID virus, the disease, how it causes and how it spreads. So since no vaccines have been provided at this time. Next is the role of the health agencies in the COVID-19 pandemic. We coming to UNICEF. UNICEF to ensure children and families around the world are equipped with all the evidence-based information and latest techniques. WHO guidance as well as locally prevented information to protect themselves, to support vulnerable countries by providing access to water, sanitation and hygiene, best infection prevention and control measures, and to provide access to care for vulnerable families and children. As the coronavirus has spread, so much misinformation fueling the stigma, UNICEF is working with health experts to promote facts over fears, bringing trustworthy tips and guidance to parents, caregivers, and educators. They are on ground in more than 190 countries, partnering with frontline responders and providing them with information and resources to keep children healthy from sickness and violence. CARE is deeply concerned with containing global spread of the novel virus. It is committed to working closely with health officials in the countries and regions where organization is operational to ensure safety and security of the staff and program. It is undergoing a contingency planning process that will position us to respond rapidly as need in the countries where we work. They are focusing on programming to raise awareness of good hygiene practice to help avoid the spread of infection. They're training health faculty staff to provide necessary support to the clinics, referral to treatment, and support the fragile public health system. Also conducting gender analysis in countries affected by the pandemic. So these are the references which can be used for the reading about the International Health Agency. So the most important we have discussed is the WHO, UNICEF, UNDP, CARE. Thank you.